Welcome everyone. We have a lot of folks still joining us from all around the country. I'm really excited to welcome everyone to tonight's monthly Medicare for All Resolutions Coalition webinar. These are really scary times, and many of us are feeling isolated and uncertain about the future. And I think that's really why it's so important for us to come together however we can through virtual gatherings like this one to support one another as we try to strategize together, how we can continue to build our movement during these challenging times. Since our last webinar 4 weeks ago, the COVID-19 pandemic has led to massive layoffs. We know 26 million Americans applied for unemployment in just 5 weeks. That means millions of people will lose their health insurance during a pandemic. There's estimated 35 million people could lose their insurance. It should not be this way. We know that while the COVID-19 crisis is global, the fallout of employer-tied health insurance is uniquely American. In every other wealthy country, people don't need to worry about losing their coverage if they lose their job. It's never been more clear why tying health insurance to employment is nonsensical and cruel. So we'll focus tonight on how we're going to respond to the emergency of millions of newly insured Americans being added to the nearly 30 million uninsured Americans already before the crisis. We have a really impressive list of speakers and activists from around the country and Canada. And we're going to hear from allies in Congress who are pushing for strong, immediate responses to this crisis while we continue to build the movement for Medicare for All. And then we will hear from a business owner who's struggling to provide health coverage for his employees, from the president of the United Electrical Workers to share perspectives from the labor movement. We have frontline health providers on the line, a public health expert from Canada who will explain how her country's single payer system is responding to the crisis. And we have local leaders who are who will share some of the creative ways that they're continuing to organize during these unprecedented times. So remember, you can write any questions you have in the chat box, or if you have called in, you can also email medicareforall@citizen.org, and we will try to we will answer your questions. If we can't get to all of them during the webinar, we will follow up with you. So let's jump in. First, I'm really honored to welcome Representative Joe Kennedy, who represents Massachusetts 4th District, to share with us about a new bill that he and Representative Pramila Jayapal from Washington are introducing to respond to the crisis of people losing their insurance as they become unemployed. So thank you for joining us, Representative Kennedy.
Melinda, thank you. First off, just thank you guys, everybody that is on this call, on the forum here, for what you do, for your activism, for your advocacy. This is obviously a brutal time across our community and a brutal time in American history. But if there is one single takeaway from it, it is that my health is linked to yours, and your health is linked to mine. And as much as there's a discussion as to when do we go back to normal, we can never go back to the normal that we had. If we try to reset back to where we were in January, all that does is invite this to happen again. We have to do better. We have to be stronger. We have to be fair. We have this unique opportunity as we do get through this moment to actually make sure that our healthcare system reflects the values and morals that we hold as a nation, and I think as human beings. And so I'm really grateful for your efforts and your advocacy, for giving me a chance to chat tonight. I know our co-sponsor and just the force of nature that is Pramila couldn't make it, but I think she's got a couple, or a member of her team that's going to be on with us tonight as well. So I'm grateful to have their expertise, and obviously no progressive force in Congress that compares to the Congresswoman. But to the other speakers tonight, to Aaron from Well-Paid Maids, to President Rosen from the United Electrical Workers, and everybody else, thank you for your efforts, your advocacy, and for having me tonight. So just really quick here, COVID-19 has been, the discussion on this for a long time has been that it was a great equalizer, that it was going to could infect anybody, young or old, rich or poor, black or white, north, south, east, and west. And while on the one hand that's true, we've obviously seen pretty clearly that the way in which it impacts us is not equal. The infection rates in Massachusetts, they just updated today. I haven't seen the latest ones as of 4 p.m. this afternoon, but the ones from the week before showed that Chelsea, Massachusetts, an immigrant community, a lower income community, a community with a large number of essential workers, a community with a disproportionate number of multi-generational households, had an infection rate of about 8 times the community of Newton, Massachusetts, about higher than that, a greater percentage, even closer to 10 times that of Brookline, Massachusetts. It was about a 4,000 person infection rate per every 100,000, by far off the charts. And when you look at the rates of infection across our Commonwealth, which has, by the way, arguably the most robust healthcare infrastructure per capita of any state in the country, Chelsea, Brockton, Lawrence, Revere, Springfield, all of these communities, lower income, immigrant, multilingual, and not a surprise that it was going to impact these communities more than others. Perhaps a surprise that it has impacted them to the extent that that it has. And so the virus really has been a diagnostic die through the showing the fractures and fissures and gaps in our society, from access to healthcare, to paid leaves, to paid time off, to public transit, and a whole wide variety of additional challenges. And so what we have is an opportunity to actually reset this. And while this needs to be, I think, a clarion call for Medicare for All, because it gives us a very clear delineation as to what it means to not just have coverage, but to have access to healthcare. We also know that Pramila and I believe that there needs to be a action for the immediate crisis here to ensure that we fill these gaps. And so the bill that we are going to be introducing imminently, the Medicare Crisis Program Act, really comes down to 3 or 4 essential parts. The first is that it expands Medicare. It enrolls the recently unemployed and their household into Medicare with coverage retroactive to the date of employment. It also eliminates premiums and limits out-of-pocket costs to 5% of monthly income, not counting your unemployment benefits. So it exempts those for all new and existing Medicare enrollees. The second is that it expands Medicaid eligibility. So the bill is going to enhance federal funding to states for existing Medicaid enrollees, increase the federal income eligibility threshold of Medicaid to 300% of the poverty level, and pay 100% of the cost for newly eligible enrollees. We've now all seen a number of those stories coming out about how states that did not expand Medicaid, how desperately they're going to wish that they did. Well, this gives some of them a second bite at the apple, which in these circumstances is a good thing. It's going to limit the out-of-pocket costs for everyone. Legislation requires Medicare, Medicaid, and all other public and private health insurers to cover the costs of COVID-19 related care, including if a patient seeks care due to COVID-19 symptoms, but ultimately tests negative. It would also prohibit healthcare providers from billing any of these services to those who remain uninsured. And look, this is critical. We had this fight with the administration earlier about making sure that testing was going to be covered, which we got. I've got some folks here that I know that have been on, and as I'm sure you all do too, that's been on ventilators for literally 2 weeks or longer. The ICU stays here. I was just with the head of a hospital a couple of weeks, 2 weeks, 3 weeks. The bills that they are going to accrue out of this are hundreds of thousands of dollars each. And so the fact that they can get tested and that test is covered with no taxpayer or with out-of-pocket expense. But if you don't have insurance and you're all of a sudden, if you test positive, you can't go into an ICU. You go back home and hope that you don't get sicker. And so this aspect of it is so critically important to make sure that the virus does not spread. So those are the basics of the bill. We obviously love to have everybody's support with it. It is clearly not a substitute for Medicare for All, but I think it does go back to the value that we highlighted early on, that our healthcare, my health is linked to yours, and that in this moment of crisis, let's create that stopgap and let's move this ball forward. So Melinda, thank you so much for letting us share a couple words on it, and happy to kick it to the next speaker.
Thank you so much, Congressman. There have been a lot of interest about the bill in the chat I've seen as well. So thank you so much. Next, I'm thrilled to welcome Stephanie Kang, who is the Senior Health Policy Advisor for Representative Jayapal, to share a bit more about this and other legislative efforts to respond immediately to this crisis while continuing to make the case for Medicare for all. Stephanie.
Thank you so much, Melinda, for organizing this and for inviting our office to speak on behalf of the bill that Rep. Kennedy just reviewed, and also a bill that we are introducing with Senator Sanders. And just before I dive into there, I mean, I think, of course, for my boss, for Congresswoman Jayapal, you know, she's been at the front lines fighting for Medicare for all. And, you know, now more than ever, it's very clear how broken our healthcare system is and how much we need Medicare for all. It's why we're seeing this huge rise in support, unprecedented rise in support across independents, Democrats. We have almost 90% of support, according to the latest poll, even rise in support from Republicans. And, you know, really it's making it clear and making that argument that we can no longer tie employment status to health insurance. And so, you know, no other comparable developed nation is experiencing the issues or trying to solve the problems that we're having to solve in the midst of a pandemic right now. So what we're trying to focus on right now are two different mechanisms. One is the Medicare crisis program that Rep. Kennedy gave us a summary about. And this really addresses the urgency of the rapidly rising number of unemployed, therefore uninsured. And we're seeing just in the last 5 weeks, there were 26 million new claims for unemployment. And so this is really about trying to make it as simple as possible for these recently uninsured to be, while they're applying for unemployment insurance, that they're able to be automatically enrolled into Medicare. And it's a sustainable way to really address this problem through sustainable public health programs, rather than relying on for-profit insurance. The other mechanism that we're focusing on too is a bill that we're introducing with Senator Sanders, and this is called the Healthcare Emergency Guarantee Act. And this is to really provide a way to empower Medicare to pay for all costs of treatment for the uninsured and any out-of-pocket costs for people who have public and private insurance for as long as the pandemic continues. So when an individual goes to the doctor, you know, they'll provide their insurance information as usual, but instead of being billed directly, Medicare would be billed instead. And so this is really to ensure that cost is not a barrier to care during the pandemic. And so both of these mechanisms address the widespread loss of insurance and the difficulties that Americans are facing right now. And, you know, both really build on Medicare as a way to, you know, complement each other, but provide strong, however temporary, responses to improving Americans' abilities to get care that they need during this difficult time. And I know that my boss feels very strongly about this, and, you know, is looking for ways to really build on reliable public health insurance programs rather than, again, propping up or relying on private insurance or employer-sponsored insurance that, you know, have wide gaps in coverage and also in terms of out-of-pocket costs. So we are introducing both imminently, as Rep. Kennedy mentioned. The Medicare crisis bill will be dropped this week, and the Healthcare Emergency Guarantee Act will be dropped in the coming weeks with Senator Sanders.
Thank you, Stephanie. There are quite a few questions in the chat, so if you're able to answer any of those, that would be great as well, and other panelists feel free to do that as well. Next, we're really lucky to have with us Aaron Seyedian, who's the owner of Well-Paid Maids. It's a living wage home cleaning company in the DC area that has 15 employees, to share his perspective as a small business owner trying to weather this crisis with the added burden of trying to provide health insurance to employees. He's a member of our important partner in this coalition, Business for Medicare for All. Welcome, Aaron.
Hi folks. So as Melinda mentioned, I'm Aaron Seyedian. I'm the owner of Well-Paid Maids, and as you can tell, we're a high road cleaning company. And so what that means is all the folks that work for us start at least $17 an hour, and we also offer a comprehensive benefits package that's similar to what folks would get with white-collar employment. And so we give 22 paid days off a year. We pay for 100% of the costs for short-term disability insurance. We pay for 100% of employees' commuting costs. And of course, you know, germane to this discussion, we provide health, dental, and vision insurance, and we pay 80% of the premium costs. Our employees pick up the other 20% for them and their dependents. So we offer great health insurance. It's the health insurance I had when I worked in consulting a few years back, and it's a platinum level, zero deductible plan. And so, you know, I feel good to offer it. I know folks are lucky to have it, and appreciative to have it. And when things are, you know, running normally, you know, it works. It works as well as any aspect of American healthcare works. And so it's costly, but we can swing it when things are running normally. Obviously, things are not running normally right now. So, you know, with the advent of the pandemic, I shut down my business on March 13th. I did so voluntarily. Cleaning is listed as an essential service in the DC area. I disagree with that. That's another story. But in any case, I didn't feel like there was any way for my folks to do their jobs in a safe fashion. To give you an idea, a typical employee of mine is going to go to over 40 different homes a month. And especially with school closures and white collar workers working from home, the chances of them interacting in very close quarters with folks in their homes and apartments would be really high. And so that's why we shut down. And you know, honestly, I still don't see a way for us to safely open until there's a much more robust public health response. And so I furloughed everybody. Shortly after that, and we tried to offer a little bit of assistance. So folks got a $500 bonus in their last check, and we also told all the employees, we're going to pay for your health, dental, and vision premiums, 100% of them, for as long as we can afford it. So that's a big question mark, right? As long as we can afford it, that's the thing hanging over everyone's heads. We're doing it for now. I don't know how long we can do it. So for this month, I put some of my earnings back in from last year into the company to pay for our group premiums. We've had a few customers who've been really great and supportive, and they've kicked in some money, offered to basically continue paying their bills without any services, and that's helped defray the costs a bit as well. And then finally, last week we got our a PPP loan, and so that's gonna help us for 8 weeks. After 8 weeks, we're right back where we started, with no certainty of where to go from here. And so, if it does come to that, if I do have to essentially lay folks off and terminate our coverage, it's obviously going to be horrible. All my employees are going to be in terrible shape. It's going to be a disaster in their lives, to compound everything that's already happened so far. So, COBRA is a lie. I mean, even white collar employees can barely use it. Poor people can't use it. In fact, because we have good insurance, it's actually harder for my employees to even imagine using it, because the premium without any aid is terribly high. And so, that's not a good solution. And Medicaid, sure, some of them will be able to go on Medicaid, maybe. Eligibility, it'll depend with every household. And beyond that, there's also going to be, of course, just a crush of demand. I've seen from my folks trying to get on unemployment that for basically the whole month and a half that they were laid off, but we didn't get our PPP loan yet. Over 3/4 of my employees, they still couldn't get unemployment, even though they were eligible. They just couldn't get through the crush system. And so the same thing is going to happen with Medicaid, I'm sure. Anyway, long story short, the crux of the matter is I don't want to kick people off of their insurance ever. I especially don't want to do it during a pandemic, but I can't afford to, negotiate the situation forever. And so that's kind of our, my healthcare crisis and our healthcare crisis in a nutshell. And maybe the final piece I'd like to say on that is that this is, of course, just the latest healthcare catastrophe that my business and my employees have endured. Owning a small business, you always know insurance is screwed up and healthcare is screwed up. But, when you're the person providing it, you get a great window into just how terrible things are. And so just really quickly, I've had, quote unquote, minor things that are still a big deal, like an employee who chose to move with her husband and work remotely. She does kind of office support for us, only to find out that because we have this regional healthcare plan, our coverage wasn't going to work for her in her new state of Colorado. And so she went with a significant gap of coverage while we had to figure out all of that. And it was, of course, pulling teeth like everything is with this. I have another employee who he bought private insurance for himself many years ago, independently, off in exchange. And even though he's been with my company for over 2.5 years, and he can get cheaper and better insurance through the company because we subsidize it, of course, he's chosen to remain on his old healthcare plan because he has two sickly parents that are basically his dependents who live with him, who rely on in-home care for a lot of really critical services. And he's so terrified that if he even moves one Jenga block, that this whole thing is going to get screwed up, and they're going to go through a long period of trying to figure out how to, continue the care with the same doctors and the same arrangement that they have. And then the worst thing that's happened, so far healthcare wise, besides the pandemic, is I had an employee who, for no fault of her own, we shut down a branch, Baltimore, wasn't working. So she lost her job, not her fault. She had a new job lined up, but 2 days after her last day with us, she emails me, panicked, saying, "Aaron, I found out I have breast cancer. Is my insurance still active?" My response, no. My second response, here's COBRA. It's not really useful, etc. And her new employer's insurance wasn't going to kick in until she was on the job for 3 months. So what a terrible, inhumane, ridiculous situation that I don't think anybody can defend with a straight face. She is doing well. We ended up paying her COBRA costs so that she could get her treatment. But anyway, these are just, it's one horrible decision and crisis after another, and the pandemic is just the latest thing. And so for all those reasons, I look forward to us hopefully winning Medicare for all one day in this country, as a person, as a small business owner, everything. And I'm really keen to see, politicians like Reps Kennedy and Jayapal not wasting this crisis, not doing things that are just going to continue to prop up a terrible system. These things I hear about in terms of like, covering the cost of COBRA or even the PPP program. They're just little patchwork things that I think help consolidate something that sucks. So let's stop doing that. And if their bill passes, and I hope it does, it's going to help my employees. It's going to help me. It's going to be a big load off my shoulders. And of course, I think it helps, hasten the end of the crisis because folks can get the care that they need. So anyway, that's our story at Well-Paid Maids, and thanks for having me.
Thank you, Aaron. And there were lots of questions for you. So if you don't mind answering them, that would be great. But thank you so much. And mostly lots of accolades coming from people the small business owner's perspective is just critical in this struggle. And so we're so glad to have you as part of this movement. Next, I am really thrilled to invite Carl Rosen, who is the president of United Electrical Workers, which is one of our key labor partners in the Medicare for All Resolutions campaign, to share his perspective from the labor movement as we confront this crisis.
Thank you, Melinda, and thank you for all the presenters and everybody who's on this webinar who I know is out there fighting the fight for healthcare justice. And it's a great thing that you all are doing it, and thank you very much for everything you do every day. So I'm speaking today from the perspective of a union that does not run its own health and welfare plans. We have, as a union, always, and when I say always, I'm talking about from the 1930s forward, favored having a single healthcare system for everyone that's backed by government financing. However, unfortunately, a big chunk of the labor movement made a decision starting in the 1940s into the 50s to go with employer-provided plans that they negotiated. And so we had no choice but to go down that road also. My union has always fought for the best healthcare coverage that we can get for workers on the job. It's what we need to do given what the realities we faced. But that system hasn't worked for a long time now. Employer-based health insurance has been in collapse for a long time now. Whether you're a unionized firm, a big firm, a small firm, it doesn't matter. It's been in collapse for everyone. There's been greatly increased costs, frequently literally unaffordable costs for workers, whether it's on premiums, on deductibles, on copays. There's been increasingly restricted networks of medical providers to try to keep costs down, but it just means that workers in those plans aren't getting the choice of the best facilities for their situations. And it's just, for unions, it's been a terrible drag on almost every set of contract bargaining in the last few decades, generally resulting in lower wage packages than we would have otherwise been able to negotiate, and has been the greatest cause of strikes. And that's just for workers lucky enough to actually have employer-based health coverage. More and more workers have been left out either because they're stuck in low-wage jobs with either no employer-provided plan or perhaps a completely unaffordable one, or now increasingly they're amongst the folks who are gig workers or other precarious type workers who are not considered to be regular employees, even though they certainly aren't small business people who can afford to buy their own plans. So we already were in this situation, and now the COVID-19 pandemic has hit, and it's greatly exacerbated the situation. Literally, as we've already heard, tens of millions of workers have lost their jobs. Many millions of them are losing their health insurance at the same time. And because of the costs, not because employers are wanting to impose pain on their employees as they lay them off, but because the cost, as we just heard, I mean, Aaron, it sounds like is a fantastically thoughtful business person towards his employees. But he can't carry those premiums forever when his business isn't operating or not operating at full steam. And so because of that cost, most employers cut off health insurance, on the last day of the month in which workers are laid off. Some unions have negotiated agreements where there might be short extensions, maybe another month or 2 months beyond that. But even when you get that, it's undoubtedly at the cost of wages, or if it's in a case where it's a permanent layoff, it's a trade-off on severance pay that workers need at that point. And now unions that do run their own health plans are seeing the double hit of both losing dues income because of the mass layoffs, as well as seeing a big chunk of premium payments into their health plans dry up. So they're having problems on all fronts. So this has just crystallized more than ever that expanded and improved Medicare for all is the only rational solution. But we also think that the political prospects have taken a giant leap forward. We've already heard about it in the polling. I'd say you can also see it in the fact that even this president, who we would not argue is a friend of working people, but he's put forward that he's now having the bills for the uninsured and underinsured who need COVID-19 treatment and testing, but also treatment now. I don't know how well it's working, but he's saying he's directed Medicare to pay those bills when people come in out of some of the funds that have already been set aside for assisting the hospitals. Now, some of this may be driven by his aversion to the ACA and anything that has to do with President Obama, but it also probably is due to the relative efficiency and simplicity of going that route. It's an obvious thing to do. And so that's why UE has embraced publicly the Sanders Jayapal proposal for this Healthcare Emergency Guarantee Act, one of the two bills that Stephanie described. We think this simplicity, this efficiency of saying that all bills for all healthcare right now will be covered by Medicare if insurance isn't covering it. It's just something that is very appealing, very straightforward for the American people. And we also think that in the midst of a crisis like this is exactly when bigger solutions can really gain ground. Money's being thrown in every direction right now anyhow. Why can't we put this on the pile? I mean, we got an extra $600 a week on unemployment benefits. Most workers who are collecting unemployment, once they can get through the system, are probably getting a bigger paycheck than if they continued to work. We've never had anything close to that in American history, and boom, that got done in 1 week. It's amazing what can be done when the political will is there and when there's the strains on the system that insist on it. So we think this is a good time to try to put this through. And then bizarrely, but hopefully it kind of follows the logic of what the Trump administration is already putting in place. Theirs is only for COVID-19 treatment. We're saying with this that it needs to be for all treatment. So we would still prefer to go straight to Medicare for all and the total elimination of private insurance. We need to get there sooner rather than later. But we think this is a hugely important stepping stone, the Healthcare Emergency Guarantee Act, that it resolves the immediate problem of millions of people losing their health insurance just at the time they might need it more than ever, while also creating a pathway forward to the more permanent solution that we need. Thank you.
Thank you so much, Carl. And now I wanted to shift gears a little bit, and I think what would be very interesting for all of us, we were able to invite Karen Palmer, who's a professor of healthcare of policy at Simon Fraser University in British Columbia, Canada, who has also lived for a long time in the United States and studies Canada's single-payer healthcare system's response to COVID-19. So I'm really thrilled to welcome you as well, Karen.
Oh, great. It's so great to be here and to see you all. Thanks for having me. So I'm in British Columbia, and as everywhere, it's a frightening and exhausting time for everyone. Like in the US, we have strong physical distancing in effect. And ironically, I think we feel that communities have actually come together while being physically apart. With some exceptions, I would say that those on the front lines and those in our communities generally feel that government cares and is trying to support us. I think we've done a good job of preparing for the COVID surge, which hasn't been as bad as we had imagined, or at least not so far. One of the biggest strengths of our response in Canada, I would say, has come through our healthcare system. As many of you on this call will know, Canada has a single payer system in each of our 10 provinces and 3 territories. And they all share common features and standards. And people are not delaying care because they are worried about the cost of care. If you get sick here, nobody in Canada lacks access to hospital or physician care. If you think you have COVID, there's a symptom checker app in each of the provinces, or you can call 811 and a nurse will advise you what to do. For any care that you seek from hospitals or physicians, you will have no co-payments, no deductibles, no co-insurance, because those things just don't exist here. So as always in Canada, care is free at the point of service and of course continues to be. In response to COVID, we actually expanded coverage to those who would not otherwise be eligible, such as temporary foreign workers with a permit that's for less than 6 months, because protecting them protects all of us. So in the midst of this pandemic, people aren't also worrying about how they will pay their healthcare bills because they don't have any. So they are more likely to seek care sooner. In terms of our hospitals, because our hospitals are all publicly funded, there's an impetus for hospitals to work together. And there's been coordination across provinces to liberate bed space, with everyone planning together across a whole region, for example, to make sure that if the surge hits hard, we can manage it. The same coordination of care is happening with hospitals supporting long-term care facilities and shelters. So people are thinking across sectors and across boundaries to take care of communities because the single payer system enables that. Our federal and provincial governments have generally done a good job, I would say, of supporting healthcare providers and patients and families with everything from a nearly overnight shift to virtual care, so people can continue to connect with their usual healthcare providers, to sourcing PPE, which has been a struggle, the protective equipment, to testing people for COVID, to helping hospitals increase critical care capacity, to supporting public health in terms of contact tracing, and to closing our border with the United States, which was unprecedented. But initially the main source of our cases was from the United States. So we can always do more, and that's part of ongoing conversations as we learn about this disease and how to cope with it. Each province has its own chief medical health officer, and there's also one chief public health officer at the federal level through the Public Health Agency of Canada. And as it turns out, these are mostly women physicians, and they have become household names across the land for the incredible job that they are doing with their daily briefings to update us all on the progression of the pandemic and our response to it. At the provincial level, the daily briefings tell us the numbers of new deaths, the confirmed cases, how many are in hospital, how many are in critical care, how many have recovered, the number of hospital beds available in the province, and the number of long-term care facilities with outbreaks. Fortunately, that number is starting to decrease. A similar briefing occurs for all of Canada as a whole with Dr. Theresa Tam, who's Canada's Chief Public Health Officer, and also with Prime Minister Trudeau. So in British Columbia, it's a great comfort to hear BC's Chief Medical Health Officer, Dr. Bonnie Henry, end her press conferences every day with her own mantra, which is be kind, be calm, and be safe. So like everywhere else, COVID has had huge effects on our economy and on employment. Beyond making sure our healthcare systems are functioning across the country, our federal and provincial governments have done a lot to support families. So very quickly, the federal government stepped up with $2,000 a month for 4 months so far to anyone who lost work because of COVID, and to apply for it's called the Canadian Emergency Response Benefit. It takes 2 minutes, and the money is in your account within 24 hours. It's amazing. I've never seen anything like it. They're also giving employers who'd lost income a 75% subsidy to help them keep employees on payroll. So they were able to rehire workers that they laid off, which will better position businesses to resume normal operations when it's safe to do that. But unlike in the US, people who get laid off in Canada don't face the worry of losing their health insurance. There is one gap in our healthcare system, and that is dental care and prescription drug coverage, which are often tied to employment through supplemental insurance. So when people lose their jobs, they also lose their supplemental healthcare benefits for things like prescription drugs outside of hospital and dental care. And so although there are many provincial programs for which people are also eligible if that happens to them, this is a gap that the pandemic has amplified, and there are calls for more publicly funded services, including universal pharmacare and universal dental care. So I'll conclude by saying, as Harvard's Ashish Jha recently said, if there was ever a case to be made that we need to go big on public health, it is now, and for at least the next 12 to 18 months. And that's true for every country in the world, including Canada. Going forward, we're now laying out guidelines to begin gradually reopening the economy, and we're not out of the woods quite yet, but we're moving in the right direction. So thanks for having me.
Thank you so much, Karen. Very much appreciate that perspective, and I think it's really important given all the misinformation that is often peddled by the supporters of the status quo in the United States. So thank you so much for bringing that perspective. Next, I'm really excited to invite several of local activists from around the country, leaders who are working in creative ways, and to give some updates about what is about organizing in this context. So first I want to invite Ashley Duhon from, she is with Students for a National Health Program in New Orleans, she is a medical student in New Orleans, and is also one of the key Medicare for All organizers in New Orleans. So welcome, Ashley.
Thank you so much, Melinda. So yeah, as she mentioned, I am a soon-to-be graduated medical student. I'm graduating in just about 2 weeks now. And I am now a former national board member of Students for a National Health Program. And I just wanted to give my perspective as someone living in New Orleans, as an area that's been hit so hard by COVID-19, and just discuss some of the work we've been doing and organizing around our city council resolution during the pandemic. And so, as I mentioned, New Orleans has been hit very hard. Our healthcare in our city had already had a lot of disparities, and these have really further been exposed and exacerbated by the pandemic, as they have been many places. But prior to COVID, over 40,000 New Orleanians were uninsured, and that number has surely risen with the rise in unemployment and loss of jobs. And as of today's numbers, at noon today, 76% of the people who have died from COVID-19 in Orleans Parish were Black, while only 60% of our population in New Orleans is Black. And those numbers are actually really similar for Louisiana as a whole, whereas 7 in 10 who have died in Louisiana were Black, while 32% of the population in Louisiana is Black. So just huge disparities in those numbers, even in a Medicaid expansion state. So there still is so much work to be done here. And additionally, the hospitality industry is such a vital part of our economy, our culture, our community, including those who work in restaurants, bars, musicians, as anyone who's visited New Orleans, I'm sure well knows. And so many of those workers were not able to get any sort of health insurance through their employers already, but now certainly they're not going to be able to afford health care or insurance with a lot of the job losses that have been occurring. And because we were hit so hard by the pandemic, some of the good news that has come out of New Orleans is that we were one of the 4 pilot drive-up testing cities. And so we were able to test large amounts of the population in New Orleans, those with symptoms. And even after that program was finished, we now have mobile testing units that have been dispatched out to some of the underserved areas in our city that I've been personally volunteering with. And to date, we've actually administered over 156,000 tests in Louisiana, which is a number I'm proud of, but of course we could be doing more. And so in regards to our resolution effort, our perspective has shifted a couple times. So we had really just started ramping up our efforts to get City Council to pass a resolution in support of Medicare for All right as the pandemic was hitting. And so initially we thought, well, maybe we should really shift it just to be in support of the Healthcare Emergency Guarantee Act, which has been mentioned already. since that is something that is so relevant to this moment. However, after some conversations with some trusted advisors, Melinda being one of those, thank you so much, we did decide to shift again to first mention Medicare for All. And in our petition letter that we have that we are currently collecting signatures for, and in our proposed resolution language, we first say a comprehensive zero cost sharing healthcare system, namely that mentioned in the Medicare for All Act of 2019. And then we also say, and additionally, any sort of emergency healthcare relief bills that would provide universal comprehensive health coverage with zero cost sharing during the pandemic, or as it relates to the COVID-19 pandemic, specifically mentioning the Healthcare Emergency Guarantee Act, but purposefully leaving it open in case there are any further bills that are introduced, as the one Representative Kennedy was speaking about. And so we've really opted to include both, to harness this energy and not really exploit the pandemic, but to use it in a way to where we can really organize around Medicare for All and continue to amplify that message, but additionally focus on some of those bills that are acutely being introduced in the House right now that we do think would benefit our city so much and so much of America. And so, yeah, that's kind of where our effort is. We are currently collecting signatures on our petition letter. And if anyone is interested in the language that we've used in our letter or resolution, I can share that with Melinda, and I'm sure we can get that out. I think that this is such a good moment for us to use our organizing efforts, both for Medicare for All and for those bills that will immediately relieve so many people.
Great. Thank you so much, Ashley. Great work in New Orleans. Next, I want to invite Christie Fogel, who works on the front lines as a healthcare provider, and also is the organizer of the Maryland Progressive Healthcare Coalition. Christie.
Thanks, Melinda. Thanks for having me on. So as a frontline healthcare provider, specifically, I'm servicing the patients of the COVID-19 population in Maryland through the emergency department and through my hospital's COVID center. So I'm well aware of the destruction that this virus is causing physically, mentally, and financially to my patients, but also to the healthcare workers as we're being laid off and we're being furloughed at shocking rates that I've never seen before. Patients otherwise, young and healthy, are requiring critical care when they come into the emergency department. I was talking to a colleague of mine the other day about how we've never experienced something like a patient who is young and healthy coming in with a cough and 2 hours later needing intubation. So this is new. And many of these patients have already been laid off from work and lost the little bit of health coverage that they have, and they're ending up with these expensive testing and bills. So as a coalition leader, my other hat that I wear, I've decided because of this to pivot the Maryland Progressive Healthcare Coalition towards organizing around this important emergency healthcare bill. Since HR 1384 was introduced, we had organized 4 large Medicare for All town hall events in Maryland in the districts of the members of Congress who did not support this bill. We had bird dogged, lobbied the members, written op-eds, email blasted, just to name a few of the things this coalition has done and the amazing activists within have been working on. We were also in the final stages of planning the first ever hearing on Medicare for All in the Baltimore City Council when the virus hit. That week we were supposed to have it, and unfortunately it was canceled because of the virus. We're planning to reschedule that soon. I think as activists, we're all faced with this brand new challenge of organizing in a socially distanced way that still strongly supports our effort, which has been difficult. In Maryland, we've decided to approach the organizing around Medicare crisis and that the Medicare crisis program proposal with a multi-step approach. As a network of progressive activists, we firmly believe that this bill is where our Maryland Democratic delegation should be. And this is where they should be focusing their support and not on an insurance company bailout bill like the COBRA bill. Given that our goal is to get our members in support, we plan to use multiple approaches to this, similar to the Medicare for All approaches. First, we would formally ask by letter that each member support this legislation and inform them that this is in the best interest of the several 100,000 Marylanders so far that have lost their jobs due to COVID-19 and likely their health insurance along with it. We're also planning phone banks, petitions, constituent letters be sent to these offices of these opposing members, asking them for support. And then similar to the amazing local resolution efforts around Medicare for All that Public Citizen has been organizing, we're planning resolutions and/or letters of support for this legislation to be sent from our county and city councils to our members of Congress. We see this as pivotal. We feel that this is extremely important that our local leaders not only stand up for their constituents, but let Congress know that we need help at the community level now more than ever. If they ever were not supporting this type of legislation, now is the time. Finally, we plan to utilize social media and email blasts amongst all the coalition leaders to raise support in Maryland with the activists and also the general public about what this legislation would mean for them. Separately, we have an organizing group that will be utilizing this time to outreach the community and talk about Medicare for All in a way that maybe people weren't willing to listen to before, but now they are willing to listen. So that's one of our many efforts. I, as a healthcare provider, personally have several virtual speaking appearances set up over the next few weeks to educate the public on this from a healthcare provider's perspective. And I'm urging all the healthcare providers that I know that support this legislation and Medicare for All to do the same. I think right now, people are really looking at us now more than ever. And I think it's vital that we step up and our voices be heard and actually listen to at this point. So that's what we're doing in Maryland.
Thank you so much, Christie. Now I want to turn it over to Abraham Ayash from Michigan United because they're doing awesome organizing up there in Michigan as well, which is also unfortunately another COVID hotspot.
Yeah, thank you for having me. Good evening, everyone. So I just wanted to let you know a little bit about what Michigan United did with our state government regarding COVID care for people. So we negotiated with the governor's office to talk with the Department of Insurance and Financial Services to get about 20 different insurance plans to cover COVID care, the cost sharing for the COVID care. So we were able to successfully complete that. And right now, we believe that you don't let a crisis go unwasted. So there's a real chance in this moment to try to organize around Medicare for All. Michigan at one point had the second highest number of unemployment per capita. And as far as number of unemployment filings in the country, right? Second to only California in terms of the number of people, and second only to Rhode Island in terms of the per capita. So a lot of people lost their jobs, and all these people who had jobs likely had access to healthcare through their employer. So this moment demands that we step up and say, let's have these conversations, because a lot of people are sitting at home, and this is the chance where you reach out. Everyone right now has a healthcare story. It's a matter of making sure that you're listening to folks to try to get that information from them and then make them ask the questions. Does it make sense that in this country that was able to give $1.5 trillion and inject it into a market to quote to help regulate it, why can't they provide healthcare for all people through a single payer system? So what we're doing in Michigan is we're targeting municipalities that our fellow Democrats who are still teetering on the issue, to show that we have multiple cities in your congressional district. For example, Congresswoman Haley Stevens and Congresswoman Alyssa Slotkin, both two Democrats who flipped red seats in 2018. So they're considered purple districts. So what we're trying to do is show them that local cities are supporting Medicare for All, and that elected officials across different cities, if they're all coming out and voting as majorities on their councils, on their board of trustees, or whatever the case may be, in favor of this healthcare system, then you have nothing to worry about in terms of the political expedient thing to do, because you have people behind you, the communities behind you, the cities are showing you that the vast majority of the elected officials are in favor of this program. So we're using relational organizing to roll out that effort, and we hope to hit Kalamazoo. Kalamazoo is a place that is represented by Fred Upton, who is now retiring, and John Hoadley is the Democrat who will likely be the nominee to take on whatever Republican challenger is there. So being able to leverage those and say, as we go into 2021, we have several cities in key parts of the state that are in favor of Medicare for All. Thank you.
Great. Thank you, Abraham. And Michigan United is one of the local partners of People's Action, which is one of our key national partners in this coalition effort. So thank you so much, Abraham. Next, Mitchell from PDA in Broward, Florida, was going to give a quick update about some creative organizing that they're planning in the context of the pandemic.
Good evening, everybody. Thank you for allowing me to be a part of the webinar tonight. We're pretty excited what we're going to be doing. We created, Dr. Caroline, who's also on the call tonight, spearheaded this whole thing. We're going to be doing a caravan of love down to the University of Miami-Jackson Hospital in Miami. We're going to circle the campus about 3 or 4 times, thanking our nurses, doctors, and all hospital workers for all the things that they're doing. Try to get them support for, to the people on the road and passerbyers to know about the bills that are going to be helping them with their protection that they need because they still don't have it. So we wanted to basically say thank you. At the same time, we're going to be pushing Medicare for all because after this COVID virus, we realize that Medicare for all is the only answer. It's the only alternative. It's a TINA thing, the only alternative. And then we're going to be driving from there in Miami along US 1, 34 miles to Broward County to go to the Broward General Hospital, which is another public hospital. And we're going to be caravanning around that hospital, again, doing the same thing. Then at 2 o'clock, we're going to reconvene at a park across the street from the hospital. And we're going to be having a webinar, which I have wonderful guests such as you, Melinda. Appreciate that. And Dr. Bill will be on. We have some nurses from National Nurses. We have doctors from SEIU. We have several other doctors that are going to be on the webinar. You're all invited to it. Just, if you want to send me an email, go ahead.
I think you went on mute. You went on mute, Mitchell.
Okay, sorry. I'm posting in the chat room the webinar and
Great.
the Facebook page, and we hope to have you all join us. It's going to be a lot of fun, we think.
Great. So again, we can't be bird dogging or doing knocking on doors in the way that we have been before. So thinking of creative ways to organize. So thank you, Mitchell. Next, and our last local leader that I want to invite to give an update is Peter Cunningham, who's with Medicare for All Connecticut, to give a report on their progress in Hamden, Connecticut.
Hi, thank you for having me. I'm really grateful to be on this panel with so many great organizers. So yeah, I'm in Hamden, Connecticut, which is a Democratic stronghold town of about 61,000 people in Southern Connecticut. And our effort started a few months ago. We started talking to some local leaders, Justin Farmer and Brad McDowell on the local legislative council about passing a resolution. They were enthusiastic about it. We started talking about ways we could kind of make a splash with it, maybe holding a big rally or a big press conference. And needless to say, that was all kind of nixed by the social distancing and COVID-19. So instead we pivoted to we had a big Zoom call with everyone we could think to invite, where we talked about the resolution, what we will want to get out of it. And we kind of drafted a resolution on the spot with the template that Public Citizen has. And some of the people on that call are on the local Democratic Town Committee. So they were able to get that resolution proposed to the committee where it was endorsed. And so it's been officially endorsed by the local Democratic Town Committee. This is a heavily Democratic town, so that's a pretty big deal. And next it just needs to go to the Legislative Council, which might take a few weeks because it's budget season. But we're now in the process of just trying to build popular support. There's a Action Network petition that we've put out with the language text to build some word of mouth, build some buzz around it. And it's just about kind of building support and pushing our local leaders to support this resolution. And with COVID-19, with the budgetary uncertainty that's going to bring. Our healthcare costs in Hamden are about $46 million a year. So bringing that down as an employer is pretty kind of a no-brainer for a town. So yeah, we're enthusiastic. And then from here, we're hoping to do some power mapping and plant the seeds for more resolutions around the state.
Fantastic. Thank you so much, Peter. It's so great to hear. So we just heard from Louisiana, Maryland, Michigan, Florida, and Connecticut. I mean, and we have, and as folks know, on our website, MedicareForAllResolutions.org, you can find a map of all of the efforts that are underway. And if you aren't already connected into one, get connected into one, or we'll help you start one. So before we end tonight, I want to invite my colleague Brittany Shanahan here at Public Citizen, who's been our main organizer on the resolutions campaign, to share a few more of the resources that we have for during this crisis time. And I also just want to remind folks that I did put into the chat and encourage folks, if you feel compelled right after this, to call the Capitol Switchboard 202-224-3121. You can urge your member of Congress to co-sponsor these emergency bills, as well as Medicare for All. So Brittany.
Hi everyone. I know we're short on time, so I'm going to try and get through this really fast. I am on a rural internet connection, so if my dad decides to look at something on my phone and on his phone, and then you lose me, Melinda will take over. So just to go over briefly the resources that we've put together for organizing this issue during social isolation. So you can find it by going to, shall I share my screen, or can you share your screen, Melinda?
I can, if you want.
Just in case. So if you go to MedicareForAllResolutions.org.
Let me grab it. Wait, I'm sorry, it's taking me a second to find it. Where did it go? All right, maybe I can't, maybe I'm...
Okay, I can do it.
Okay, you do it. I don't know why it's not showing up.
All right, here we go. So hopefully you all can bear with me. So this is the MedicareForAllResolutions.org website. If you go there, and again, it's Medicare for, the number 4, allresolutions.org. On the main page, towards the bottom, there's COVID-19 resources. And then that has resources for organizing for Medicare for All during the COVID-19 crisis. Now, just to say a quick few things about it. For one thing, we do have, we did put, when we put this together, it was before being on a Zoom call was kind of the new normal like it is. So I imagine a lot of people are more used to being on Zoom than they were a month and a half ago. That being said, I would say that I think that one of the common denominators for struggles people are having is just trying to figure out how to make the space of a video meeting work. And some ways to do that can include sticking to a shorter agenda, and having a timekeeper, getting someone to remind everyone what time it is and if you're keeping to the agenda. I happen to be a huge process nerd. I love talking about agendas and how to get meetings to run better and finding out how other people have gotten their meetings to run better so I can steal their ideas. So feel free also to send us an email if you have any questions or would like advice on setting a meeting up on Zoom, or if you need someone to help you host it, we may be able to help you. So my email address is bshaNNAHAN@citizen.org. There's a link right there. We also have a link to a page that has a list of guidelines for writing a letter to the editor about COVID-19 and the need for Medicare for All. We've got some tips on how to get printed, how to format and structure your piece so that it fits what the expectations are from your paper, some talking points. And then in addition to that, you can also, another reason to get in touch with us is just that we We've helped a lot of people put op-eds together, and if you have ideas and you want to know, does this sound right? Feel free to bounce it off us. We're happy to work with you. So that's my screen out. And so finally, just to remember that even though this crisis right now is very urgent, we are building a long-term movement. And so when it comes to hosting these meetings online, which is very important, and I'm happy to help and work with folks to make this work, it is a different medium, and it's okay to not finish everything in one meeting and to set smaller goals and to just keep the band together, to keep having those relationships with the people you're organizing with. Even if you're doing a third of the work, it's that you're staying in this together. As always, I'm always happy to chat outside the webinar about creative ideas for organizing in these strange times.
Thank you, Brittany. And so we are at our hour. We've covered a lot of ground. We had many, many panelists, but I think it was very engaging and inspiring, all of the commitment, the resiliency, the creativity of our movement. We are physically isolated. I think when this started, I wondered what is Medicare for All organizing even going to be? And what we've seen is that it has emboldened many of us. Obviously, the arguments couldn't be clearer, and why we need this and why we need to act. And people are all over the country are doing that, and business owners, labor leaders, and consumers, healthcare workers, everyone. And so I think we will continue these virtual connections in our communities as long as we have to. And I'm really grateful for each and every one of you who joined us this evening. We had a really robust participation in this webinar, very exciting. And many thanks to Congressman Kennedy and to Stephanie from Representative Jayapal's office and all our champions in Congress, as well as activists around the country. So we'll plan to have our next webinar in 4 weeks, which will be on Thursday, May 28th. You can mark your calendar. We will keep you posted. And if you have ideas for upcoming webinars, let us know what they are, and we'll be happy to, or if you want to give an update from your community, let us know. So thank you again so much, and please stay safe. Thanks to everyone for joining us. Take care.